I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. Welcome to the NEI podcast. On this show, I sit down with renowned mental health care experts from a range of diverse backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions. In this episode of the NEI podcast, we are discussing something that's so important for this time of year. We are talking about seasonal affective disorder, or SAD. And I have here with me today Dr. Jade Wu. Dr. Wu is a board-certified behavioral sleep medicine specialist and researcher at Duke University School of Medicine. Welcome back to our show, Dr. Wu.
Thank you so much for having me.
So my first question for you as we dive into this very, very fascinating topic is, what exactly is seasonal affective disorder? We hear a lot about this in the news and the media, but could you explain for us, for our listeners, what exactly is SAD?
Yeah, SAD is a very interesting form of depression that is recurring, episodic, and most importantly, seasonal in nature.
Mm-hmm.
So in the vast majority of cases, at least, in the Northern Hemisphere, the depressive symptoms onset in the fall, peak in the midwinter, and subside completely in the spring. So There is a very clear seasonal nature to this. And so because winter lasts about 3 or 4 months, the typical episode lasts that long too. And so for this disorder to be diagnosed, it's not technically its own diagnosis in the DSM, it is a form of depression. But for this particular subtype to be diagnosed, a person must have at least 2 seasonal episodes in the past 2 years. So there has to be some pattern established. And over the course of a lifetime, more seasonal episodes than non-seasonal. So it can't just be like someone has major depressive disorder, sometimes it's in the winter. That doesn't count. It has to be a clear seasonal pattern that is primarily a seasonal thing. And so it's most common in northern places that get a lot less daylight in the winter months. So for example, this is an interesting prevalence fact, which is that the prevalence of a SAD in the Philippines is only about 1%, but it's more than 10% in Denmark.
Oh, wow. That's crazy. That's incredible. Oh, wow. So what would you say are some of the most common symptoms? Like, how would someone be able to know or suspect whether they have SAD?
So the symptoms are actually pretty much just the same as in what we think of as regular depression or non-seasonal major depressive episodes. So this would include low mood, loss of interest, feeling hopeless, changes in appetite and sleep are big ones, feeling really low energy and tired, loss of interest in sex or other fun activities, difficulty concentrating, having trouble making decisions, the very typical sort of physical and cognitive and emotional changes that happen in depression.
So then how do these symptoms differ from major depressive disorder? Do they differ at all?
Well, there's not too much difference. Well, the main difference is that it's seasonal and it's very predictable in when it onsets. And a couple of smaller features that are interesting too are, one is that it's could be a longer episode than your typical depressive episode because, it lasts as long as winter, which can be 3-4 months, whereas in regular depression, an episode could be as short as 2 weeks or so. And for people with SAD, the sleep changes tend to be more of a hypersomnolence, so sleeping too much, sleeping more than usual, whereas in typical or non-seasonal depression, it could go either way. It could be hypersomnolence or insomnia, or, some other sleep change. And lastly, I would say one thing that sometimes we overlook in treating seasonal affective disorder is that we treat the symptoms when they happen, But we
Mm.
forget that there's a lead up to it. If someone has had years and years of seasonal depression, they start to anticipate it in the fall,
Yeah.
even in the late summer. If there's starts to be like a dread that starts building. Like I know personally for me, I've lived in northern places,
Mm.
basically my whole life until recent years since I've been in North Carolina. And every
Okay.
year leaves start to fall. I'm like,
Yeah.
oh, here we go again.
Yeah. Yeah.
So
Yeah.
there's definitely a cognitive component that may actually worsen the symptoms
Mm.
or start the onset earlier in the fall than it really needs to. So that's an interesting kind of tidbit about SAD specifically.
Yeah. Wow. That's so interesting. And with that being said, we're so used to thinking of SAD as only pertaining to the winter months, but is there any evidence that people might experience SAD in conjunction with, say, a different season?
Yeah, so this is really fascinating. So I should start out by saying that the vast majority of SAD research has been done in northern places because
Mm-hmm.
it's more obvious and more common in northern places. And also most psychiatric research has been done in places like the US and Europe. And, so there's a lot of confounds in terms of how we understand the seasonality. For all we know, summer depression could be just as common as winter depression, but that's
Okay.
not what we see in the research. But the research is also done in a non-representative way. That being said, it does seem like if we take the research that does exist, increasing latitude, so the more north you go, the higher the prevalence of seasonal affective disorder. And here we're talking about winter depression.
Right.
But there
Right.
are rare cases of summer depression, even in the northern hemisphere. But then if we do look at the little bit of research that exists in more southern places,
Mm-hmm.
there are higher proportions of summer depression cases in
Oh,
those places,
that's.
but it's not a complete flip. It's not like,
Mhm. Mhm.
90% of bad cases in India are summer depression. It's still sort of more tense toward winter, but that's because the latitude isn't exactly, like like Sweden is further north from the equator than India is south from the equator.
Right.
So,
Right. Right.
so
So
it's
you're
hard
saying
to
the
say.
latitudes aren't equal, the distance.
Exactly.
Yeah. Mhm.
Exactly. Yeah. So, but this pattern is pretty consistent with the photoperiod hypothesis for SAD, which is that, the more daylight there is, the less risk of SAD. And the more
Mhm.
north you go in the winter, the less daylight there is. So depending on the latitude of where could be at higher or lower risk at winter blues, whereas summer, that's less well understood.
Mhm. Mhm. Now, what are some of the risk factors for SAD? What do we know about that?
Yeah, so there is a genetic component. So we know from twin studies
Mm.
that an identical twin to someone with SAD is twice as likely to have it themselves as someone who's a fraternal twin to someone with SAD. So there's clearly a
Wow.
genetic component. And there's some evidence that melanopsin mutation is the
Uh-huh.
culprit here, or is at least involved here. And melanopsin is a photopigment gene. So it could be that people who have two copies of this gene, who are something like 5 times as likely to have SAD, they are just
Wow.
less sensitive to light, which, if you already have way less light, if you live in Sweden and you have like, I don't know, 5 hours of daylight and you're less sensitive to light, then of course that
Mhm.
puts you at higher risk because your body is basically in hibernation mode all day. And
So fascinating.
yeah, I know. It's very interesting. And there are likely other genetic components, but there's
Mhm.
not been a ton of gene studies done on this topic. So we're
Mhm.
not really sure. We also know that women and younger adults are more at risk for SAD. There are some
Mhm.
estimates that as much of 90% of SAD cases are in females. Um,
Wow.
but I
Wow.
wouldn't necessarily hang my hat on this one. The
Okay.
evidence is not super strong, but
Okay.
generally it is accepted that more than half of cases are in females. And young adults, in their teens, 20s, and 30s are also
Mhm.
more at risk. And so people with SAD also tend to have a higher rate of other psychiatric comorbidity.
Mm-hmm. Mm-hmm.
So, I mean, this makes sense if someone already has, say, dysthymia or
Mm-hmm.
anxiety disorders or, something else. They are more vulnerable to the changing amounts of light, to other sort of triggers for SAD. So, having
Right.
another
Right.
psychiatric disorder puts someone more at risk as well. And we've already talked about living in a more northern latitude.
Mm-hmm.
It certainly is a risk factor. And so this part is a little bit interesting, but I think could be confounded as well. There's one interesting study that found that people in more individualistic societies
Mm.
have greater rates of SAD, but I'm wondering if that's confounded by the fact that, Scandinavian countries, Canada,
Oh, yeah.
northern parts of the US just tend to be more individualistic societies,
Mm-hmm. Mm-hmm.
whereas more southern places like, I don't know, Italy, India are just like more collectivistic cultures. So I don't know if
Mm-hmm.
there's
Mm-hmm.
really a social component to this. There could be because, one of
Mm-hmm.
the risk factors for depression in general is isolation.
Right.
So, that is just a sort of even more just like a fun thought experiment, not necessarily
Mm-hmm.
something to hang our hat on. Um,
Right.
and then, so one couple of last risk factors that I'll say, which I'm particularly interested in as a circadian and sleep researcher, is that later chronotype, meaning someone is more of a night owl, just biologically hardwired as more of a
Mm-hmm.
night owl, is more at risk for SAD.
Oh, interesting.
Yeah, yeah. And there's some hypotheses for why that's the case, part of
Okay.
which I think we'll talk about later when it
Yeah.
comes
Yeah.
to circadian rhythms. But just real quick spoiler alert here that, when we have a later chronotype, we're just in general more likely to have any type of depression because
Ow.
we are just more misaligned. So
Right.
our biology is just more misaligned with our social obligations. So someone
Gotcha.
who ideally would be sleeping, from midnight to 8 or from like 2 to
Mhm.
10, but they have to get up at 6 or 7 for work or school, they are just constantly misaligned in their circadian
Right.
rhythms between their biology and their
Wow.
social activity. Yeah, and that misalignment is terrible for our
Yeah.
mood.
Yeah.
Um,
Exactly.
yeah, and that's exacerbated for people who live in northern climes, people who
Mhm.
are already more vulnerable to SAD. It's basically like a hyper extreme chronotype misalignment in the winter.
Right.
Um,
Wow.
yeah,
That's
and
incredible.
yeah, it's really fascinating. And there's further kind of circadian clues because we also know that someone in the western end of a time zone is also more likely to have SAD
Ah.
because they get less daylight exposure, especially in the
Mm.
mornings. So if you think
Mhm.
about it, like, so you're in Colorado?
Yes.
And so are you, I don't know the time zone like maps
No,
very well in the middle of the country.
I'm on
You're on mountain
mountain
time.
time.
And
Yeah,
are
and
you
no,
on
I
the
can't.
western or eastern
So I'm now on the western slopes,
Mm,
and yeah, I absolutely agree with you. One of the most difficult, challenging things for me is that I am actually a night owl, but over the course of my adult life, I've kind of forced myself to be an early riser morning person. So
mhm.
my husband and I like to get up at like 4 or 5 a.m. and
Oh
hit
my
the
gosh.
gym. Yeah, or go on hikes and things like that in the morning.
Uh-huh.
And that's so easy to do during the summer for us. But come
Mm,
winter, oh my goodness, it is dark until like 7:30 a.m., which is
yes.
like, it's
Yes.
way too late for
Mm,
us to start our day. So it's very difficult to get up when it is still dark. Like my
yeah,
body doesn't want to get up until the
exactly.
sun is out. Like really weird.
Exactly. Yeah.
Yeah.
And there's a very good reason for that. I mean, that's not just, sometimes I think we stigmatize night owls or later risers as, oh, they're just lazy or they like to
Hmm. Hmm.
party and then sleep in. That's not really it. I mean, there's a
Hmm.
real biological underpinning to a later chronotype. And
Right.
the reason that you don't want to get up when it's still dark is because your body is still in sleep mode and
Yeah.
has not revved up yet. It's like
Yeah.
just asking your body to function at a time when it should not be functioning.
Right.
And
Right.
that is exacerbated in the winter, and that is
Mm-hmm.
exacerbated if you're in the western part of a time
Yeah.
zone.
Yeah.
And that's again exacerbated if you have social jet lag. So
Mm-hmm.
if someone is getting up a lot later on weekends because they can finally get to sleep in,
Right.
but then they have to yank themselves back on Monday morning to an
Yeah.
early wake schedule, then all of those factors compound together to make it just really awful
Mhm.
for all aspects of health and mood, but certainly
Yeah.
exacerbates the risk for SAD.
Right. Right. Yeah. And I think it's so important to focus on the importance of sleep when it comes to things like mood disorders and really just our overall mental health.
Hmm.
So you did just share so much with us about, the genetics possibly involved and how sleep plays a role. So that actually leads me to my next question, which is, do you know if there are any neurobiological explanations for SAD? And is there something to be said for that circadian clock and how this just affects our overall mental health? I know we just talked about that, but if there's anything else that you'd like to add.
Yeah, sure. So a couple of interesting rhythmic changes. So one thing to just sort of know is that our biology is just so driven by rhythms, whether that's on a
Right.
seasonal scale or monthly, daily. So we just our bodies are just meant to run on rhythms. And
Mhm.
one normative rhythm on a seasonal level is that serotonin transporter binding potential is generally greater throughout the brain in the winter than the
Oh,
summer.
wow.
And that's for everybody. But with people with SAD, especially with severe SAD, this fluctuation is more extreme. So they're kind of riding a bigger roller coaster between summer and winter when it comes to just
Oh,
serotonin
wow.
functioning in the brain. And
Okay.
I don't think I understand exactly how that leads to more SAD specifically,
Mhm.
but
Mhm.
we know that serotonin is just so intricately linked in so many aspects of our functioning, including a huge part of mood
Right.
regulation, so that
Right.
whenever I think there is a bigger fluctuation in change or a
Right.
disruption of some sort, I mean, that certainly could disrupt mood.
Mhm.
Um, and very interestingly, and this speaks to the circadian aspect of things, people with SAD have a more prolonged daily release of melatonin in the winter. So melatonin is a major feature of the circadian system. It's sometimes referred to as the hormone of darkness because it's
Mhm.
released basically in sync with the night. It onsets
Right.
as the sun sets, it ramps up, it stays high during the night, during the
Mhm.
darkness, and then it subsides in the day when the sun rises.
Mhm.
And it's very much impacted by light. Like if we have a lot of bright light at night, like if
Mhm.
we have, a super bright iPad in our face for hours, then that's going to delay our melatonin release. And if we have not a lot of light exposure during the day, we'll have more melatonin for a more diffuse melatonin release throughout the 24 hours. So
Mhm.
this is a hormone that's extremely sensitive to light. And in the winter, for people with SAD, melatonin has a longer daily release period. So it's almost like your
Mhm.
biological night is longer if you have
Mhm.
SAD. So this, speaks to what you were saying earlier about that hibernation mode. It's
Mhm.
almost
Mhm.
as if in the winter, people with SAD are literally more in a hibernation mode for longer period of the
Right.
day. So yeah, so then that would explain the fatigue and the low
Mhm.
energy
Mhm.
and, difficulty concentrating and the circadian misalignment. People with SAD, as I said earlier, have more delayed sleep timing. So that
Mhm.
makes them even more out of sync between their biology and their social obligations in
Right.
the
Right.
winter. And I think I mentioned earlier, people with SAD may also be less sensitive to light, not in their
Mhm.
visual system. It's not that they see less. It's not like they
Mhm.
can't
Mhm.
physically see or
Mhm.
that their brain can't process the visual aspect of light. It's the non-visual component, the
Right.
non-visual photoreceptors in the retinae that are potentially passing on kind of less light induced
Right.
signal to the brain.
To the brain.
Yeah.
That's so fascinating.
Yeah,
Wow.
yeah. So between all of this, the neurobiology of someone with SAD might look
Mhm.
pretty different,
Mhm.
between their serotonin system being different,
Mhm.
their melatonin system being different, their, circadian systems being less stimulated by light. And it could kind of lead into a bit of a neurobiological and behavioral sort of vicious cycle where, the more paltry the light in the environment and the more fatigue and low energy they feel, the longer their biological night is, the less they go out and do things,
Mhm.
which makes it so that they have even less light exposure, less behavioral
Right.
activation, less social interaction, which leads to even more depressive symptoms, which leads them to stay in bed longer. So then it just ends up being a hibernation cycle.
Right. Right. Wow. So, with that being said, are there lifestyle alterations that people can make to help with SAD? What kinds of
Yeah,
things could they maybe do if they know they have this? Is there anything they can just kind of change in terms of their daily routine to get through this season?
yeah. So that's where the good news comes in, I think, is that our biologies are actually quite responsive to
Mm-hmm.
behavioral changes.
Mm-hmm.
So there's nothing really surprising here. It's really the same changes that we would advocate for in non seasonal depression, things like exercise, light
Mm-hmm.
exposure, social activation, good nutrition, and of course, regular and good quality sleep.
Mm-hmm.
So, and there are really good reasons for all recommendations too, like exercise really activates your system, really releases, the neurochemicals that are mood boosting. It's light exposure, of course. So this whole time we've been talking about northern latitudes and lack of daylight. And so, it's no surprise that light exposure, especially light exposure during the day. So not more light exposure at night. That'll make things worse. More light exposure during the day, ideally sunlight, which is doubly, triply good because if you're out in sunlight, you are also probably more physically active. You may be socially interacting with people more, which are all really good mood boosters. Good nutrition. There is some evidence that having more protein and vegetables in the winter can be protective, more
Yeah.
fish apparently. So
Mm-hmm.
I'm not sure how strong the evidence for this is. I again wouldn't hang my hat on this one, but the prevalence of SAD in Iceland is
Mm-hmm.
lower than you would expect it to be, given that it's a
Wow.
Scandinavian and very
Uh-huh.
northern place,
Oh,
in,
yeah.
in part potentially
Mm-hmm.
because it has a higher fish content in their diet.
Mm-hmm.
So I don't know if that's not really a replicative finding and also not a
Mm-hmm.
experimental finding, just an observation. So that could be
Mm-hmm.
interesting. And of
Yeah.
course, with sleep, sleep can play a pretty big role in mood in general, and
Mm-hmm.
perhaps especially here because sleep behaviors impact the circadian system and then are also impacted by the circadian system. So getting on a
Mm-hmm.
good sleep routine could be one of those positive cycle situations that really ameliorates the risk.
Right, right. So then that takes me to my next question, which is what are the treatments for SAD? You
Mm,
mentioned things like, lifestyle changes. You
mm,
mentioned the light.
mhm.
How effective have these kind of sun lamp lights been to treat SAD?
Yeah,
And are
so
there,
uh-huh.
I know
Mhm.
you have so much experience with CBT for sleep disorders. Is there anything like that for SAD? Like CBT for SAD? What are
Yeah,
some of the things that you know about?
for sure. So light therapy is effective. It seems moderately effective. And usually what this involves is what you mentioned, the light box, for about 20 minutes in the morning. And
Okay.
this is a light box specifically for light therapy purposes is something that is broad spectrum, bright, at least 10,000 lux light that is placed about 2 or 3 feet in front of you, not like staring directly into the light, but, sort of directly falling on the face, slightly sort of diagonal to your eyes.
Okay.
And so that is used actually in non seasonal depression as well, but it's particularly good for seasonal depression
Hmm.
for all the reasons that we've already mentioned about light. So that's very good. And there's also SSRIs tend to be the pharmacological
Hmm.
treatment of choice. There's not really super high quality evidence to really support one or two medications and say, okay, these are like definitely the first line treatments. But, SSRIs, of course, are, much more accessible to people uh, than CBT. So,
Right.
that's certainly worth mentioning. And so that brings me to CBT, which is a multi-component therapy, cognitive behavioral therapy. And there is a specific one for SAD. And so the reason CBT is good is because it combines a lot of different components. It
Mhm.
does include often does include light therapy, and it has things like behavioral activation, scheduling activities to get out there and exercise and see friends and be in the
Mhm.
sunlight and to regularize our rhythms. And there's also the cognitive component, which addresses kind of what I mentioned earlier about the dread and anticipation of,
Right.
of the symptom
Mhm.
onset in the fall and winter. And it can really help people to understand why they have SAD and the biological underpinnings of SAD, which can be really helpful for patients to know because it's very destigmatizing and it's clarifying, demystifying, and it
Right.
helps people to understand that, oh, this is just a biological process where I may be more genetically prone to experience these changes seasonally, not like there's something wrong with me. I'm a hermit
Right.
that just like goes, into this terrible mode of being asocial and a hermit in the winter. There's something wrong with me. So the cognitives and the psychoeducation component, I think, can be very helpful. And so it's actually very interesting that there are some clinical trials where they put CBT and other treatments head to head. And not surprisingly, CBT plus light therapy, which often CBT already includes light therapy in practice. But if we combine those two, it's better than light therapy alone and better than CBT alone. But if we combine just CBT alone versus light therapy alone, they're about equally effective for this year, for this winter, and equally about effective for a follow up next winter. But by
Mhm.
2 winters from now, from when you receive the therapy, people with the CBT who received CBT 2 years ago are
Mhm.
better off than people who received light therapy 2 years ago.
Wow.
Yeah.
That's amazing.
Yeah, so that's, I think, very telling and very interesting
Mhm.
because
Mhm.
I think that shows the skills and the knowledge from CBT can help people to modify their behaviors because when they understand the rationale and the
Mhm.
reasoning behind
Mhm.
their symptoms and what they're
Mhm.
recommended to do, they're more likely to keep it up and do it themselves.
Right.
Whereas
Right.
2 years later after light therapy, they might have lost their light therapy box or they can't find it
Yeah.
in the attic or they forgot about it. They don't remember
Yeah.
why it's important to have light. So
Mhm.
I think personally, my go-to would be CBT plus light therapy. Yeah.
That sounds great. Yeah.
And one last thing I'll say about head-to-head comparisons is that CBT seems somewhat better than SSRI, but it's also better than CBT plus SSRIs. So adding SSRIs to CBT actually can make it less effective.
Oh,
So
wow.
yeah, so I don't know how much this finding has been replicated, but it's a really interesting pattern, and I
Yeah.
wonder if there's a self-efficacy component here.
That's what I
Yeah, is
was
that
going
what you're
to ask.
thinking?
Yeah, absolutely. I think that one of the reasons CBT seems to be so effective for a range of different mental health conditions is that it's really empowering the individual, right? And I
Hmm.
think that when it comes to something like SAD, I think most people would probably feel somewhat helpless, like it's just something in their physiology or something that they
Hmm.
can't control. And then I had never really thought about that cognitive component that you mentioned, that it's true that once someone becomes aware of having had these symptoms in the past, then each year they start to dread that season. But
Hmm.
if they're able to alter that cognitive component, I think that can be very empowering for them and thus maybe more long lasting.
Yeah.
This could be one explanation. I don't know, but maybe they are sort of relying more on the medications in that instance and then not really working through, altering the cognitive portion.
That's possible that there's less motivation or less time spent on the cognitive and the behavioral components. It may also be that they end up attributing their improvement to the
Mhm.
medication more
Mhm.
than to
Mhm.
their own behavioral change.
Right,
So,
right.
so that when they do get better, they think, oh, yeah, the talking to the therapist was helpful, but it's probably the medication that really
Mhm.
did the trick. And if that's the case, then they are perhaps less likely to keep up with the behavioral changes after the, short-term therapy is done. And so
Mhm.
they get less of the benefits
Right,
from
right.
overall. So that could be why. In any case, it does seem like CBT is a really good option. But there are many people who don't have access to CBT. It's not like there
Right,
are
right.
just so many therapists out there trained in
I
CBT for
know.
SAD just
I
waiting
know.
to, deploy every winter. That's unfortunately not how it works.
Right.
So certainly I think if one major challenge for the mental health professional community is to, I think, disseminate the psychoeducation and the lifestyle change recommendations and really working on scaling these treatments so that maybe we have some digital therapeutics, maybe we have more light therapy that's
Mhm.
more
Mhm.
easily deployable. It's certainly a challenge to be
Right,
worked on.
right. Absolutely. So, just how common is SAD? Do you
Mm.
know anything about the statistics or if that's changing over time?
Yeah, I'm not sure that I know whether they're changing over time. That I have not looked into. The prevalence rates are kind of all over the place, in
Mhm.
part fluctuating by latitude, so
Okay.
by the sample population, and in part because the methodology for defining SAD has not been super consistent across studies. But generally in
Mhm.
the US, it seems like people agree on something between like 1% and 6%, most sort of falling in the 4 or 5% zone.
Okay.
So it is certainly common enough to be taken seriously and
Yeah.
to
Yeah.
affect quite a bit of quite a number of people, and probably even at a higher rate for the more northern states.
Mhm. Mhm. Well, this takes me to my last question, which is how important is sleep in the management of SAD? And what advice do you have for people who might have altered sleep patterns during these seasonal changes? What can you
So
tell us?
I may be biased because I am a sleep researcher, but I think it's very important in the management of
Mhm.
SAD. And that I think there's a lot of potential to treat SAD and even prevent a lot of SAD symptoms through sleep.
Mhm.
So,
Mhm.
one interesting thing about SAD sleep is that it's more likely to be hypersomnia or hypersomnolence compared to insomnia. So this is sleeping too much or feeling too sleepy. So what ends up
Right, right.
happening is people will often spend more time in bed. They'll end up napping more and napping haphazardly, not in like a good sort of healthy siesta culture,
Mhm.
like you would see in Greece in the summer, not like that, but like falling asleep in front of the TV after work kind of thing.
Mhm.
So what ends up happening is that drives even greater circadian dysfunction because as we mentioned earlier, we already know that there's circadian misalignment. There's already more diffuse melatonin secretion throughout the 24-hour day. There's already just so many circadian problems. That for people who are vulnerable to SAD, that we really need to work even harder to secure our circadian robustness in the winter
Mhm.
if we
Mhm.
are at risk for this disorder. So I would say with sleep, it's not even all about sleep. I would say first and foremost, it's about circadian rhythms. So that means it's extra important to try to get up at the same time every day.
Mhm.
Extra important to get lots of bright light during the day, especially
Mhm.
first thing in the morning, which
Okay.
will help to keep you circadian aligned to the
Mhm.
social rhythm that you have to keep,
Mhm.
especially because people with SAD tend to be more night owls, and being
Right.
a night owl is already hard enough. And one of the ways to fake like being more like a morning person biologically is to get bright light in the mornings. So that's extra important. And then also to try to minimize light exposure at night.
Gotcha.
So not to say that you have to turn out all lights after sunset and be, just in the dark all evening. That's not feasible and not fun. And probably you'd be really bored and just fall asleep on the couch anyway. So it's okay to have lights on and to watch TV and use your phone and everything. But maybe, put on night shift mode on your phone, wear blue blocking glasses, late in the evening. This is to help you not shift more and more into a night owl schedule to sort of between the bright light in the morning and the blue blocking glasses at night. That'll sort of help you to stay on track, stay steady with your circadian rhythm. And also in terms of napping, I would say it's fine to take a nap. I mean, listen to your body. If your body wants more sleep, needs more sleep, give it more sleep, but try to do a scheduled brief nap rather than just letting yourself kind of doze off for a minute at a time or 2 hours at a time at random times of day. So maybe if you're working from home, for example, schedule like a 45-minute meeting in your calendar so that people don't bother you during that time, and just lay down for, half an hour, 45 minutes. Don't try to force sleep. If it's not happening, don't try really hard, but maybe give yourself that time to just rest. And if you fall asleep, great. And one last thing I'll say about this is less of a circadian thing, but more of sleep and prevention of insomnia thing, because even though we tend to have more hypersomnolence with SAD in the winters, we can also then end up developing insomnia, because what happens is you're so tired and so kind of blah, your mood is so low that you end up spending a lot more time in bed too. Maybe you're spending even more time in bed than the increased amount of sleep that you need. So you end up having lower sleep efficiency. You end up tossing and turning in bed a lot more. Your sleep is more broken up at night, or it takes you longer to fall asleep. You end up getting frustrated about not falling asleep. And lo and behold, we end up developing insomnia and inefficient sleep. So then you end up with an even more disrupted rhythm, having broken up sleep at night and time during the day to get sunlight and to exercise and to be active. And then you're also more tired during the day because insomnia is very frustrating and exhausting. So then it could become a vicious cycle. So I say, for those of us who are more prone to SAD, more prone to sleep issues, more prone to circadian issues by being a night owl, really try to avoid spending too much time in bed, really try to avoid the social jet lag of the weekday versus weekend sleeping in situation. Don't fly yourself from New York City to LA and back every weekend with your biology. That's a big risk factor for mood problems, and be really good about having a big contrast between your light levels during the day versus night.
Excellent. Well, thank you so much for all of that incredible information. And thank you for being a guest on our show again. It's always a pleasure.
Oh, thank you so much for having me, Sabrina. It's always so fun to chat with you.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.